If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now today we're going to be talking about one of the most important and common parasitic diseases in the world, Schistosomiasis, in which more than 200 million people are infected worldwide. In terms of impact, this disease is second only to malaria as the most devastating parasitic disease. Joining me to discuss this neglected tropical disease is Rosemary Drisdelle. Rosemary is a parasitology teacher and author of the book, Parasites, Tales of Humanity's Most Unwelcome Guests. Hi, Rosemary. Welcome back to the show.
Hi there. A pleasure to be here, as always.
Good. Now, parasites of the genus Schistosoma are from the class Trematoda. And we've discussed a number of trematodes over time on this podcast. However, it does differ from some of the other flukes in a couple of important ways. Rosemary, how are schistosomes unique among the trematodes that infect humans?
As you said, there are a couple of ways that they're unique and quite different. For one thing, there are male and female worms. Most of the trematodes are hermaphrodites, so they have both male and female characteristics, but with the schistosomes, we actually have males and females. Another thing is that rather than living in the intestine or the liver, they live in the blood. And they only have one intermediate host. Most of the flukes have at least two, the ones that infect humans. The other thing is that they're very small. Some of the liver flukes are quite small, but the schistosomes have them beat. They're actually so small that even in a pair of male and female worms, they could curl up on the end of your little finger. They're very tiny.
Now, schistosomiasis is often referred to as bilharzia. Where does this name come from?
They're actually named after the person who discovered them. Theodore Bilhars, back in 1852, discovered the worms that cause schistosomiasis around the bladder, the ones that cause the urinary type. So it was named after him initially.
Okay, well, there are 5 schistosomes that caused human schistosomiasis. Rosemary, what are they? Where are they found? And follow up with that with how many countries today still see schistosomiasis?
Yeah, there are 5 that we sort of refer to regularly. 3 of them are the really big ones, and there are actually also a couple of other species that we don't refer to quite as often because they just occur in very small geographical areas. Schistosoma mansoni is found in South America, some of the northern countries in South America, the Caribbean, and in Africa and the Middle East. And then we have Schistosoma japonicum, which occurs in China, Indonesia, and the Philippines, as its name suggests. Schistosoma hematobium is known in Africa and the Middle East, also the island of Madagascar, and quite recently introduced to Corsica. And then we have Schistosoma intercalatum, which looks a lot like hematobium, but is a little bit different. That's found in some areas of Africa. And Schistosoma mekongi occurs, as you might guess, along the Mekong River, so in Kampuchea and Laos.
So how many countries today still see human schistosomiasis?
Now, the World Health Organization lists about 70 countries that still experience it. And actually, it's still very common. As you said, over 2 million people infected and about 206 million people at risk.
Now, the life cycle, I love listening to you talk about the life cycles of these parasites. And the life cycle of the schistosomes is pretty complicated, isn't it?
It is, and it's fascinating. If we start with the egg itself, that would be passed from an infected human, either in stool or in urine. If that egg finds itself in fresh water, then it will hatch. There's a little creature inside the egg called a miracidium, which is very active, which swims about very actively in fresh water. They're quite fascinating to watch. And what they're looking for is a specific species of snail. It's not just one species of snail, but it is fussy about which species it can go through its asexual stage of development in. So if it finds the right type of snail, it will invade the snail's body and go through, as I said, an asexual stage of multiplication, eventually leaving the snail, and then it hangs around in the water, and it's like a little balloon in the water, and it rises up to the surface and then slowly sinks down towards the bottom, moving back and forth like that, hoping that an appropriate human host is going to come along. And if one does, they actually will latch onto the skin. At this stage, they're called a cercariae, and they will penetrate the skin, disappearing through the surface of the skin in about 10 to 30 seconds. They will enter the bloodstream and travel to the heart, and then through the lungs and into the systemic circulation. Their goal at this time is the liver. They spend a little bit of time maturing in the liver and pairing up as male and female worms. And from there they travel to whichever part of the body their specific species is inclined to spend their lives around. So some of them go to the tiny capillaries in the blood vessels around the bladder, and some will head for the intestine. And there they remain as male and female pairs, with the male actually wrapped around the female like a little blanket, and she basically just spends her life producing eggs. So those eggs are released in the tiny capillaries there, and most of them, particularly in Mannsoni and Hematobium, they have a wicked-looking sort of spine on the egg, which helps to lodge them in place. And they will eventually break through the wall of the capillary into the surrounding tissue, and with a little bit of help from our immune system, they will work their way towards either the lumen of the bladder or the intestine. And once there, of course, then they can be passed to the outside world, and the whole thing starts all over again.
And so people do contract this by contact with contaminated water.
That's right, contaminated fresh water. Yes.
Fresh water, right.
Yeah.
And if you're in an area where schistosoma is endemic, it's really almost impossible to tell if that water is contaminated.
That's right. The only way you might know, and especially if you were exposed to it for the second time, you might feel a kind of prickling sensation as the cercariae are penetrating your skin. But no, you probably would have no idea until that happened, that you were being exposed.
Now, schistosomiasis is sometimes considered a man-made disease. What is meant by that?
Indeed, it's one of those parasites that we have catapulted from probably being relatively rare to being extremely common as it is today. And we've done that by creating the perfect environment for the life cycle to complete itself. So water resource projects, dams, create large lakes, as you know, with usually a lot of vegetation growing around the shores of the lakes. This creates ideal snail habitat, and it also creates ideal habitat for people. So we have people moving to the shores of these large lakes where they can obtain water whenever they need it. They can go fishing. They can even, grow some of those water plants, and the children play in the water, and laundry gets done in the water. So there's a lot of human contact with the water, and that tends to really ramp up the amount of schistosomiasis in the area.
Now, schistosomiasis is an acute or a chronic disease, but it's not a single disease. It's kind of a disease complex.
That's right.
Rosemary, I want to focus on the big three schistosomes, Schistosoma mannsoni, Hematobium, and Japonicum. And for each species, can you discuss the pathology and the morphology of the adult and egg? And let's go ahead and start with Schistosoma mannsoni.
Yeah, so I mentioned that Mansonia is one of the ones where the egg has a really wicked-looking spine, and this is the chief characteristic by which we can identify that species of schistosome. We find the eggs in the stool. So for all of them, basically the initial infection would be characterized by chills and fever, perhaps tiredness, headache, kind of a severe flu-like illness with fatigue and perhaps some swollen lymph nodes and maybe some gastrointestinal symptoms. But that does fade away after a while. So for Mansonia, actually for all of them, the initial infection would be much the same. For hematobium, well, Mansonia, I should mention, lives around the intestine, so we find the eggs of Schistosoma mansonia in the stool. That's also true of Japonicum, Schistosoma japonicum. Hematobium's a little different. We find the eggs of that species in the urine. And that one, hematobium, is associated with bladder cancer, and that's probably because of the constant sort of chronic irritation of the bladder wall due to those eggs moving through the tissues. So with chronic Mansonia, you're going to see perhaps some bloody diarrhea, abdominal pain, and lethargy, which goes on for, well, basically forever because people don't really get over it. These worms can live for 20 to 30 years. And similarly with hematobium, we see bloody urine. And people in places where these parasites are endemic, they know the symptoms and the signs, and they consider it quite normal. Often they don't place a whole lot of importance on seeing the bloody diarrhea or the bloody urine.
Now, obviously these produce a lot of eggs, and the pathology is directly related to the number of eggs too, I imagine, right?
Yes. As time goes on, the eggs that are passing through the tissues tend to get kind of enveloped in tissue that the body produces, and they don't get passed in the urine or the stool in quite such large numbers, so it can be hard to find them. But the other thing about these eggs is that some of them, of course, get swept away in the bloodstream. And so they can build up in parts of the body, particularly in the liver, where the bloodstream goes, and cause a lot of liver damage, cirrhosis of the liver. And you see pictures of people with chronic schistosomiasis with very enlarged abdomens because they've got a buildup of fluid in their peritoneal cavity. And they tend to be, as I mentioned, very, very tired and lethargic. And children don't grow. Their growth can be quite retarded, so there can be quite small stature if they've had schistosomiasis for their whole lives.
Now, as somebody who's worked in a parasitology lab, these characteristic eggs are very hard to miss. It's a
yes.
very easy diagnosis.
That's right. The only thing you have to really watch out for is that if they roll over, especially with Mansonia, if they roll over on your microscopic preparation so that the spine is underneath, sometimes you don't see it. And so you might miss it that way or think that it was something else. But fortunately, in a wet mount, you can tap it with a pencil and get things to roll over. So that's a little trick we use a lot.
Now, are there other methods, serological or otherwise, for identifying the schistosomes?
There are, but unfortunately, there's nothing that works really, really well. If we look for antibodies, well, those take a fairly lengthy amount of time to appear in the bloodstream, so you can't always identify an acute infection accurately. And then if we look for the antigen, if we look for the parasite itself, those tests tend to be somewhat unreliable. You miss a lot of positives that way. So there's nothing that really is reliable all the time. For travelers, probably the best way to look for a schistosome infection is to check for the antibodies and just wait a bit of time and see if those antibodies develop. But if we're checking people in endemic areas where there will be a high level of infection, then usually we look for the eggs in the stool.
Now, a lot of times with the schistosoma infections, people may not realize they have it for decades after. I remember hearing stories of people come back from World War II and finding out as an elderly man or even post-mortem that they had the infection.
That's right. As I said, the worms can live for decades, so you can have it for a very long time and not realize.
Yeah. Fortunately, treatment is pretty well established for schistosomiasis.
Yes, praziquantel is the drug of choice, and it's quite effective. But of course, the earlier the better, because once you start getting that tissue damage and the cirrhosis of the liver and eggs building up in various parts of the body, it can be too late to reverse that damage.
Mm-hmm. Now, concerning prevention and control, I want to talk about the individual traveler to an endemic country. So if me or you are traveling to parts of Africa or South America, what should we be concerned of?
Well, you definitely want to avoid contact with any fresh water that was suspect, that you thought might be contaminated. So that would include drinking water. You could boil that, or you could filter it, or perhaps let it stand for about 24 hours before consuming it, but you certainly wouldn't want to dip it out of a pond or even take it from a tap if you thought the water came from a pond that could be contaminated. You wouldn't want to bathe in it either without heating it first, so to about 50 degrees centigrade or 122 Fahrenheit would be, for 5 minutes, would heat your bath water enough. Chlorinated swimming pools would be okay as long as you were confident that the chlorination was at a sufficient level, but that would be your key to avoid contact of your skin with water that could have those cercariae in it.
Mm-hmm. Now, is there a vaccine for this parasite? And if not, is there anything out there in the pipeline?
There isn't a vaccine so far. There is a lot of research. A lot of people are doing research on trying to develop a vaccine, but at this point in time, no, there's nothing.
Now we'll turn to more large-scale prevention and control measures. What are they doing out there for these, hyper-endemic areas?
Yeah, when control is really, it needs to take a multi-pronged approach. So mass treatment of people, sometimes everybody in a community needs to be treated. Sometimes just people, school children in particular, because we know they love to play in water, right? And adults who are at risk. So those would be people who have common contact with the water. Fishers, women perhaps who gather water or do laundry, pregnant women, that kind of group. If they were picking different groups that would be at higher risk, those would be the ones they would choose. So mass treatment of those people with praziquantel, and then providing clean drinking water is important. Improving the sanitation, because of course what you really need to do is prevent eggs from entering the fresh water in the first place. And then education of the population and snail control. Although snail control, it's hard to kill every snail. They do tend to come back. So it can be helpful, but it's not going to work in and of itself.
And I would even think education would be a little bit difficult because you got populations that have been defecating and urinating in the water for generations.
Right. And often people who live in these endemic areas don't really take the infection all that seriously. They don't take it as seriously as perhaps we would.
Yeah. All right. And there has to be many fascinating stories, historical or otherwise, about the schistosomes. Rosemary, what do you have for us today?
As you say, there are lots of stories and hard to choose one, but I think perhaps my favorite is the theory of what actually happened in Jericho. We all know the story of Joshua and the Battle of Jericho, the biblical Old Testament story, which has Joshua arriving with the Hebrews at the village of Jericho and walking around its massive walls a couple of times, and the walls all came tumbling down. But the version of the story that involves schistosomes, and of course this is not proven, but there is some evidence that there could be some truth to it, suggests that the people of Jericho they all had chronic schistosomiasis. We know that one of the snail hosts was there because remains of that snail have been found in the rubble of Jericho. And we know that they were trading with people who came from areas where the parasite was well established. So it's certainly believable that Schistosoma hematobium could have been introduced to the spring, which supplied all the water for Jericho. It's in a very arid place, and their only source of fresh water, really, without having to walk a very long way, was that spring. So the people had contact with the spring water all the time, and they used it for everything from bathing to irrigating their crops, and anything they needed water for, they would go to the spring. So once that spring got contaminated, then every person in Jericho would have been exposed to the water just about every day of their lives. So the thought is that by the time Joshua arrived there with his army already, the people of Jericho were very sick and lethargic, and they were not doing a good job of maintaining their defensive walls around the village. Things were ready to topple already, so it was an easy task for Joshua and his troops to take out the village. And then the story tells us that Joshua cursed the village and that nobody lived there for hundreds of years. Mm-hmm. And so though it's populated today, it was uninhabited for long enough that the parasite would have died out with any hosts, there to help it finish its life cycle. And also there were some very dry periods in that time which might have wiped out the snail as well. So it's a plausible story and quite fascinating, I think.
Oh, it really is. All right. Well, again, thank you, Rosemary Drisdelle, for your time and expertise and your fascinating stories. I appreciate it.
My pleasure, as always.
Thank you.